Apparently during a phase 2 trial for visceral adiposity in HIV patients, the CJC trial was terminated before it completed because after the 11th injection, one of the patients had a myocardial infarction and died. So moving on down our peptide list, if we go to CJC 1295, this has to work well because it doesn't even have an actual name. Mm-hmm. It's just a combination of letters and numbers. So I assume this is a very powerful peptide.
Yeah, it must be. Research peptides are some of the favorite ones because everybody's always looking for the next best thing that is going to be the single magic bullet that's going to fix all the issues. And in reality, there are some peptides and also just non-peptides that we're excited about that are still in the research and development phase. But this is no exception. It actually has gone through clinical trials, and they were stopped for relatively, actually very concerning reasons.
Yeah, so if you look at some of just the initial dosing that was done in healthy adult males, adult females, you did see pretty substantial doses, so 30 to 60 micrograms per kilogram. This is, say, your 100 kilogram male, just for simple math. That's 3,000 to 6,000 micrograms. So that's probably your whole peptide vial, and even up to 90 micrograms per kilogram. And it did increase growth hormone and IGF-1 substantially, but you wouldn't necessarily want growth hormone and IGF-1 to be sky high all the time.
Yep.
So this is a lot of times touted as, someone told us the other day in a conversation, the best peptide for anti-aging. And we smiled politely. But in any case, I don't know that you want those to be elevated because there are risks that come along with that.
Yep.
And it's not uncommon that I see a patient who comes to our practice to kind of get their routine or regimen sorted out, and they'll say, well, I've been taking CGC, I've been taking BPC, I've been taking Epitalon, I've been taking this. And my question is, how long have you been taking those things? And with the BPC, I think the record I've seen is between 2 and 3 years that someone had been on that continuously.
Yeah.
Is that about what you've seen, or have you seen someone who's been on that longer?
I haven't seen longer than a couple of years, but I've certainly seen a lot of patients who plan to remain on it indefinitely, especially patients with a lot of chronic musculoskeletal injuries and also inflammatory bowel disease.
Yeah, so I counsel those patients that we definitely want to use the minimum effective dose. We don't want to be taking something that's going to elevate carcinogenic, like it's not going to elevate risk factors for cancer growth like angiogenesis or growth factors, growth hormone, IGF-1, tend to be overexpressed on atypical cells and cancerous cells. So it doesn't look good on paper. And it's kind of paradoxical because there's a lot of people who are very young who probably don't need to be taking these things. They probably have plenty of growth hormone and IGF-1 around. But at the same time, when someone is younger, that's when the relative risk is going to be the lowest when you don't need the medication. Whereas someone who is, let's say, 60 or 70 years old, perhaps they have developed adult onset growth hormone deficiency. They stand to benefit more from the medication. But at the same time, the risk is higher. And sometimes there are other ways that are much better to improve quality of life versus throwing a peptide at something.
Yeah, that's a good way to look at it. The risks and the benefits often raise at similar levels, and then just making sure the patient understands their individual risk and their individual benefit is important.
Yeah, but anyway, into the juicy part of this story. Apparently during a phase 2 trial for visceral adiposity in HIV patients, the CJC trial was terminated before it completed because after the 11th injection, one of the patients had a myocardial infarction and died. And they suspected that it was unrelated, but that the patient had asymptomatic coronary artery disease. Good reason to get your cardiac risk factors checked, get some imaging done if appropriate. But in any case, I think this is really interesting because some of the earlier preclinical data on peptides, like I think GHRP6 in particular, look like it would be very protective in these sorts of vascular events. Like they would ligate the coronaries or ligate something in a mouse model, give them this peptide, and look at that. There's no damage from this period of ischemia. But this is a perfect sort of human case report of this same scenario where there's a period of ischemia and it did not have that same protective effect. This person, in fact, passed away.
Yeah, there's a couple interesting things that you can take into account in a situation like this. I suppose one of them is you can see, in hindsight, we're not able to see. They didn't publish a lot of specifics on this case report, but they did mention that it was about 2 hours, I believe.
Yeah, 2 hours
after the injection, and about 1 hour after the MI, the myocardial infarction, began, passed away after 1 hour. So passed away 3 hours within injecting, and then the MI, at least the pain, which is it can start before that, but the pain from the ischemia began 2 hours after. But this patient had been on the CJC in the trial for quite a while longer before that. Perhaps it was incidental, but certainly long enough to presumably raise IGF-1. So you're thinking about the effects of IGF-1 on estrogen and potentially the effects on like a platelet and the clotting cascade as well.
And glucose being elevated, perhaps.
Yep, glucose and insulin as well. So there's a lot of factors that could be at play, but it is that's pretty much the, at least that we know of, the last clinical trial. Was that phase 1 or phase 2?
I think it was phase 2 at this point.
Yeah. So yeah, compared to a lot of other things that can lead to very similar goal, which is presumably improving either lipodystrophy or improving a growth hormone deficient or borderline growth hormone deficient patient, there seems to be better options.
Agreed.